And then, okay, so we are all set. So good evening, everyone. Thank you so much for joining us. We are in downtown New Albany, and this is the second of a series related to firearm violence. And tonight we're specifically discussing access to firearms and mental health. And so I want to tell you up front, this is being recorded. We will be sharing this online on the YouTube page of LifeSpring Health Systems. And if you have any questions during our discussion, please drop those into the Q&A on your toolbar, and we will get to those questions as we can. So again, thank you so much for joining us. Thanks to our host here at the New Albany Floyd County Library. My name is Beth Keeney. I'm the CEO at LifeSpring Health Systems, and I am so delighted to be with you tonight to talk a little bit about some of these issues facing our community. I'm joined tonight by two panelists, starting with Krystal Wallace, who currently serves as the Crisis Intervention Director at LifeSpring Health Systems for Mobile Crisis. Her professional interests include focusing on developing and initiating community crisis intervention, addressing the mental health and daily living needs of the severely mentally ill. Krystal wants to assist both adults and children who have a severe trauma history, as well as those who have substance use disorder. She has assisted in the development of the Crisis Call Center for LifeSpring since 2023, as well as managing the mobile crisis team for 11 counties in Southern Indiana. So thank you so much, Krystal, for joining us tonight. We're also joined by Clark County Prosecuting Attorney, Jeremy Mull. He has 25 years prosecuting criminal cases in Clark County and is now in his third term as the elected Clark County Prosecutor. Prosecutor Mull has extensive law enforcement experience domestically prosecuting criminal offenses ranging from misdemeanor property crimes to capital offenses, in addition to significant international experience. Of note to our discussion this evening, Prosecutor Mull has spoken nationally about Indiana's red flag laws and has testified in front of multiple state legislatures on this issue. So thank you, Prosecutor Mull, for joining us tonight. I will just remind everyone, we are talking about some topics that can be very heavy and emotional. And so I would just encourage you, if you need to take a break, step away from the conversation. This will be available online on video. So if you aren't able to make it through tonight's discussion, that is certainly okay. It will be available for you later if you need to. I will also say this is not a political discussion. I think that we can all agree that that firearms are part of our reality, and also we need to be safe with them. So no matter how we feel about firearm regulation or policy, what we can all agree on is that we don't want people to be hurt or unintentionally harmed.
We're receiving word that the volume is low on our end.
Okay.
So we're going to move this closer to you all.
Thank you very much. Is that better? Are you able to hear us better? Okay, so we will continue. Thank you so much for letting us know about that. So again, questions can go into the Q&A feature on Zoom. This is being recorded and it will be available online at a later time. If you aren't able to get through it completely tonight, please don't feel that you have to stick around if it becomes too heavy for you. So with that in mind, I want to just start off by asking Krystal, if folks are having a difficult time, maybe having thoughts of hurting themselves or others, that can be a medical emergency. And so what would your advice be to someone in that situation?
Well, if someone is thinking about hurting themselves, we want to address the needs that are there. So it may be something physically going on. They may be in some type of physical crisis. They may be in some type of emotional crisis. So we want to be able to address the needs there. We want to be able to provide them with assistance. One of the things that my team does is we go out and we support individuals where they are in their crisis. So if that individual is just now experiencing maybe a sign of depression. We want them to be able to identify what's going on to prevent them from engaging in any type of self-harm or any type of dangerous situation.
So how would they get in contact with you, or in that state, what would your advice to someone be?
We would have them to call the crisis line, which is 833-723-3988. We have those.
Can you say that again?
833-723-3988. Or you can also think of it as 833-SAFE-988. We are a part of the 988 national hotline. So if an individual either text 988, or if they call into the 988 hotline, they will also be routed to LifeSpring's mobile crisis team as well.
Okay, so 833-SAFE-988 is how you can access immediate care for yourself or for a loved one, or by simply dialing 988. So thank you for getting us started there. I want to come back to you and just ask generally, how do you know if someone is in a mental health crisis? What does that look like to the family or parent or friend or neighbor? Or what does it look like for yourself?
So individuals, before they're in crisis, they tend to show you signs. So it may be mood changes. They may make statements as, I feel hopeless. They may feel isolated. So they may also isolate themselves from other individuals. They may start to give away possessions, or inadvertently, they may start showing some physical signs. So they may sleep more. This person may engage in alcohol use or substance use. These are signs that you want to identify to know that someone is in crisis and needs some support.
Great, thank you. Prosecutor Mull, turning to you, I think a lot of times there is this kind of belief that for a lot of crime, and certainly violent crime, that there's a mental health component. But we know statistically more often than not, it's not mental health caused. Can you talk a little bit about of the criminal offenses that you see, what is the mental health component most significant, and how does that play out?
Yeah, with the crime that we see in the criminal justice system, so much of that is actually driven by substance abuse. In fact, I say oftentimes that probably over 90% of the things that I see in Clark County are substance abuse related. But when we're talking about the nexus between mental illness and crime, a lot of times this will show up in property crimes and the types of things that people see with windows being broken and that sort of thing. But when it comes to firearms, it can be the case that individuals going through mental illness do obtain firearms and do threaten other people with them and do use them at times. And so certainly I've had cases where whether it be something more of a minor level, but certainly on a serious level where firearms were involved and there was a mental health nexus with that.
And you and I both serve on the suicide and overdose review team in Clark County. And looking at some of those statistics, in 2015 to 2019, death by suicide using a firearm accounted for 53% of all of those causes of death. In the previous 5 years, 2020 to 24, that number rose to 67%. So we know at least locally that firearms are playing a role in more deaths by suicide, but I wonder, in other types of offenses, are you seeing more firearm violence in offenses involving a firearm?
Yes, I am. We continue to see increase in firearms across the board when used in criminal acts, but especially in juvenile crimes. We're seeing a lot more juveniles procure firearms, use those in offenses, be armed with firearms when they're committing offenses. And some of the offenses that are being committed are in furtherance of using firearms. For example, just reviewed a case recently where some individuals have been going to a local sports store and stealing ammunition. So the call came in as shoplifting, but as that investigation unfolded, it turned out that they were there to get the ammunition for the weapons that they were carrying as juveniles. So this kind of spreads across the board, and there are a lot of crimes that are related to this illegal use of firearms.
Well, that's certainly alarming to hear about our young people. Kind of segueing into that, children and access to firearms can be quite risky. If you are a parent, and this is for either of you, what sort of advice do you have for parents around access to firearms?
Well, I would start by saying that absolutely they need to be locked up and secured. And, there are multiple ways to secure your firearms. If there are juveniles and children in the house, you can use trigger locks. There are multiple mechanical mechanisms that can be used to secure those. They can be locked up in a safe. But you have a legal responsibility to make sure that these firearms are not going to be used by a juvenile to harm themselves or anyone else. And again, there are many ways to go about securing those. I think that the local health department may have trigger locks or some devices that are available, and certainly those are available for purchase.
Thank you.
To add to that, as parents, you also want to be able to have those conversations with your youth. You want to be able to talk to them about gun safety, as well as recognizing signs when they're depressed and how to seek out help for them. You want to be able to have those conversations that it is okay to talk to a therapist about the things you're feeling and the environments that you're in and how things are going at school, because we know that a lot of youth, they tend to hold things internally and they need to be able to have outlet. So having those open conversations with the youth about guns in the home, making sure that they are aware, hey, if someone comes over to the home and they have, say, a gun, or if they're playing with a gun, hey, you need to go at.
Tonight, the temperature will be below 35 degrees. The white flag shelter will be open.
We're going to pause just a moment for announcements.
To 10 p.m.
Feels a little bit like being back in school.
From November 15th through April 15th, when the temperature is below 35 degrees for 4 hours or more. The white flag shelter is located at 4007 Grand Line Road. Anyone needing transportation to the shelter can use the TARP bus system. Please see the flyer at the upper or lower customer service desks or cafe for more information. Departure times for the shuttle tonight are 6:27 p.m., 7:46 p.m., and 9:06 p.m. Departure is at State and Oak. Arrival is at Grand Line and Houseville. Once again, departure is at State and Oak. Departure times are 6:27, 7:46, and 9:06 p.m. this evening. Thank you.
Please stay safe in the cold. But let me go back to you, Krystal. So you were just talking about making sure that children have an open line of communication and just awareness of the impact that firearms can have.
Yes. And having that conversation that if they do see one of their friends having a gun on them, hey, go and talk to an adult about this, as well as making sure that our youth is aware of how they can prevent being involved in any type of gun violence. Talking to others, staying away from guns. We, as parents, we need to make sure that a gun is secure, like Mr. Jeremy just said, as well as making sure that ammunition is not in the same place as the gun.
Okay. And can you talk a little bit about just how children and adolescents who have behavioral health concerns may present to teachers or parents, and what they can do just to make sure that those children are in safe environments, whether they're at home or going to a friend's house or to school?
Well, with teachers, as well as other community members, having teaching those life skills. Again, appropriate gun violence. What should we do if we see someone with a gun? We should, go and notify another adult. If you're having thoughts of suicide, who could we talk to? we have a therapist, we have our teachers. Having, again, that open line of communication, parents, talking to another parent, hey, do you have a gun in the home? If so, you know, can you please secure it? If, a clinician is involved, having that conversation with the family, this is appropriate gun safety. If you know that your youth is now experiencing some level of depression, anxiety, their first manic episode, this is what you should do. We should safety plan. We want to secure all firearms. We want to put all sharp objects up. We want to have that safety plan in place so that the family feels that as though they can manage the situation, as well as the youth know, this is what I need to do to keep myself safe as well.
Right. I'm definitely, Prosecutor Mull, one of those parents who makes it a little weird and will ask other parents, you know, are there firearms in your home? That's okay, but are they locked up? I don't want my children to have access to them. Is that something that you advise people to do, or is that a better way? Is there a better way to do that?
I think absolutely it's a good idea to police that when your children are going to be going to another location, to make sure that it's a safe place, that you know where the firearms are at. I mean, let's be honest, culturally, a lot of people have weapons in their home, and a lot of times people let their children at some age begin to start getting familiar with those and use them, especially in the rural areas where there's hunting, etc. But making sure that you know exactly what firearms are in a house and where they are at, how they are stored, would be a responsible thing to do as a parent. And I want to just recognize something that Krystal said, that if your child is experiencing these sorts of behaviors where you can tell that they're going through a mental health crisis, that they're maybe being bullied, that they're maybe exhibiting signs of aggressiveness to others and at school, those are signs that you should be very careful with your firearms, to make sure those are locked up, to make sure that you're going into your children's rooms and spaces and looking and making sure that there aren't firearms there. But a lot of times these things are going on and these individuals have access, and it ends up culminating in something tragic later. And so recognizing those signs and taking action are what's important.
Thank you. Sticking with this idea of mental health crisis and the role that that can play in just really tragic outcomes, can you talk a little bit about suicidality and suicidal ideation? Is that, you know, the kind of the traditional thinking was, if somebody wants to kill themselves, they're going to figure out a way to do it. Can you talk a little bit about the impulsivity of suicidal behavior and how we may use principles of harm reduction to reduce some of that risk?
For parents, we want to take any threat that a child makes seriously. We don't want to pacify and say, oh, well, my children is just making a statement to get attention. No, we want to be able to be proactive. When it comes to our youth, we want to be able to support them. And one of the ways that we can support them is being able to recognize that suicide is real. Youth tend to act impulsively and they don't think about the consequences later. So a lot of times when youth are experiencing suicidal ideation, if you have a gun in a home, you increase the likelihood of them being able to have access to a means to harm themselves. So securing that weapon, removing it from the home, decreases their ability to act upon the suicidal ideation, as well as for adults as well. But we want to make sure that our youth, because they tend to, when they experience depression, they tend to internalize and they don't see a way out of their depression. Most individuals, adults included, when they experience depression, anxiety, schizophrenia, or any of those mental health conditions, they tend to feel alone. They tend to feel overwhelmed, and they tend to feel as though there is no way out. And so decreasing their likelihood of harming themselves is a responsibility that we all have. And by making sure that we secure the weapons, we talk to them again. I preach on the importance of talking to youth. That helps to decrease the likelihood of them harming themselves. Right.
Prosecutor Mull, turning to substance use disorder, what role does your office see, that substance use disorder plays into, criminal offenses involving firearms?
Well, one of the things that individuals who have substance abuse disorder will do is try to come up with money to fund that addiction. And so a lot of times that will manifest by either individuals being armed with weapons while they commit burglaries, while they commit crimes. A lot of times it results in individuals stealing firearms to pawn or sell those later to make money. But a lot of times it just results in bad judgment. Individuals who are under the influence of substances, who have weapons, who end up making wrong decisions with those weapons because they're not, functioning with a right state of mind because of impairment. And so that can result in impulsive or not thought out use of those weapons and result in violent crimes. And so we see it again manifest in many ways in the community. But the worst is when they actually produce and use the firearms because they are under the influence.
Krystal, substance use disorder is something that affects all of us directly or indirectly. Can you talk a little bit about how someone may access help for a loved one, or how someone could access help for themselves for substance use disorder? I know one of the things that we hear often is that people are very scared to go through withdrawal or to go through a detox process. Can you talk a little bit about what resources are available locally to someone who may want to make the first step toward addressing their substance use, but are scared about what that looks like?
I'm gonna kind of revert back again and talk a little bit about the Mobile Crisis Line. One of the benefits that we have is that we have peer support specialists. And so when an individual is having a thought that they want to regain or engage in recovery, we have peer support specialists available at our Mobile Crisis Line, which is 833-723-3988. And that individual can walk them through the process, how their body may respond, mentally, how they may engage in some paranoia because of recent substance use, and now their body is saying, hey, what's going on? So we have peers that are available. We have the Turning Point Center. Turning Point Center has beds available for inpatient for a 28-day program that allows individuals to not only address the mental health condition that is associated with the substance abuse, as well as they have peers that have been along, they can walk alongside them and help them through the process. One of the things with individuals when it comes to substance abuse, they, again, just like I kind of talked about with individuals with depression, they tend to feel alone. And so if you want to decrease someone from engaging in any types of substance abuse or any suicidal ideation, they have to know that they have a community. And locally, there is Project Care that goes out to help individuals when they've experienced an overdose, just so these individuals do not feel alone in this process.
And a peer is someone who has lived experience, who has experienced substance use disorder and has entered recovery.
Yes.
That's great. And again, 833-SAFE-988 to be able to access services. You and I both work for LifeSpring Health Systems, but there are many recovery focused and treatment focused organizations in our community, including Centerstone, Wellstone, Sunrise Avenue. So just, I think I would speak for all of us when I just really would encourage you that if you have a substance use disorder or care about someone who does, please call any of us. We just want you to get the help that you need. And so understanding that substance use disorder and behavioral health issues can play a role in impulsivity around firearms and firearm violence, I want to talk a little bit about what you can do during that space. So for example, if you have a sibling or a parent or a child or a neighbor that you're concerned about having, an acute mental health issue or acute substance use disorder, and you know that they have a firearm. That can be a dangerous situation. It's not one necessarily that we would want to send a mobile crisis team to. So talk to me about what that looks like. How do we get help for that person in an acute state?
Well, we work a lot with dispatch. So for mobile crisis, if an individual called and said, hey, my significant other is experiencing a mental health crisis, but they have a firearm in the home, we may not deploy out, but we will go ahead and contact dispatch and let them know this is what this person is presenting with, and this is what this person may need. They may not need 3 or 4 police officers out to the home because it may overwhelm them, but they may need at least 2 out, just for safety and just so that the person can be secure. We also stay on the phone a lot of the times with the individual so that they can go ahead and relinquish their weapon. One of the things that we found recently is that law enforcement, if they know that the person is willing to relinquish their weapon and that individual has a suicidal ideation, they will secure that weapon for them so that they can go ahead and get the help that they need at one of the local hospitals.
Right. And so can you talk just for a moment about emergency detention orders? So even going around, so like, let's say the crisis line is not necessarily the avenue that you want to take, and as a concerned loved one, you're interested in doing an emergency detention order. What does that look like?
Emergency detention order allows for the individual to be placed in inpatient for about 72 hours. So if it was a loved one and they were calling in regards to one of their family members that is experiencing a mental health crisis, one of our clinicians could assess, but also the local hospital could as well. Law enforcement is able to go out and also do an emergency detention order if needed. And that's only when we cannot get that individual to go to the hospital, but we know that they need the help. So unfortunately, it is something that has to happen for some individuals, specifically those that we feel like poses a risk to themselves or to others.
Okay, great. Prosecutor Mull, can you talk a little bit about what that looks like from your perspective? I'm sure that you get calls all the time from family members and loved ones and neighbors concerned about someone who may have possession of a firearm. What does that look like from your perspective?
As prosecutor, I utilize something that we call the red flag law in Indiana, or the Jake Laird law, and named after a police officer who was murdered by an individual with mental illness, who had weapons that had been tried to have been withheld from that individual, but had to be returned to him legally. And so the legislature in 2006 passed this red flag law. And what that does is it authorizes law enforcement officers to take those weapons temporarily away from individuals going through a mental health crisis who are dangerous, who are deemed to be dangerous either to themselves or to other people. And that can happen in a couple of different ways. One is if a member of the public reports to the police that they have this concern, the police can go out, and if they are on the scene and encountering that individual and that individual's armed and they develop cause to believe that this individual fits that definition of a dangerous person, they can take the weapon and put it for safekeeping and then submit that paperwork to my office for us to file something with the court and then ultimately have a hearing. Or officers can, in the alternative, if they get this information, get a search warrant to go to an individual's home and to take the weapons. And again, we would have a hearing afterwards. And what that looks like is we just have a hearing in front of the court and we present evidence that this individual at this particular time is going through something and is dangerous either to themselves or others, and that they need to not be in possession of a firearm or be able to go out and purchase one. And if the judge makes that finding, then those firearms are ordered held by the court, and that individual then who the weapons were taken from can come back in 6 months and demonstrate that they are in a better state of mind than and not dangerous, and at such time the weapons would be returned to them. If that's not the case and it's a longer lasting situation that's going on with the individual, then those weapons will be held up until such time as the individual has recovered and is able to safely possess those. And if that doesn't happen after 5 years, the court would then order them to be sold.
I think that is such an interesting point, because I have heard concern that using that red flag option criminalizes or penalizes someone, but it sounds like it's the opposite. It sounds like it's an additional safeguard with some due process checkpoints built in.
Yeah, the whole intent of this is that it is a temporary removal of that person from the weapons so that that person is safe and that other people are safe. And I'll tell you that, most of the cases, I would say more cases than not, those weapons are being removed because the individual is suicidal and is going to harm, him or herself. And most of the time, almost always, when the officers talk to the individual, they recognize that and will say, yeah, you probably need to take those away. I'm not in the right mind to have them around. And that's usually done by mutual consent. And then I'll follow up and file the paperwork and have the hearing just so that if that individual changes their mind later, they can't go out and purchase a weapon or get those back until it's clear that, that they've received some treatment and are better. Sometimes we file these though to protect the community from shootings and murders and violence. There are individuals who are mentally ill that threaten to come in and shoot up their workplace or threaten to shoot, their spouses or significant others. And, I've had several of those where it was just necessary to file these and to temporarily store those weapons so that someone wasn't hurt or killed.
And so when you are involved as a prosecutor, oftentimes that seems like something that's criminal, but is this a criminal action or is this a civil action?
No, absolutely not. Now, if the individual has committed a crime, it could be looked at that we would charge and file a red flag action, but more times than not, when we file these, it's simply a civil action that's filed. No one is charged with a crime. The person doesn't even have to come to court if they don't want to do that. If the officers take the weapons and I file the paperwork, the judge will set up for a hearing and the individual can either come or not come. The judge makes the finding. Then they're just, again, temporarily held and stored. And that individual can produce it anytime after 6 months and just say, hey, here's some records of treatment and a witness, and I'm, doing better. And then those would be returned, but it is not a criminal action. You're not charged with anything. You don't go to jail. You don't get anything on your record criminal wise if one of these is filed.
Okay, great, thank you. And so again, if someone is listening now or later down the road through the YouTube recording, and they are concerned about a loved one who may be expressing suicidal ideation or homicidal ideation and they know has a firearm, how would they be able to access that red flag?
Well, the most direct and efficient way to do that is simply to call 911 and let the dispatcher know what's going on and ask the police if someone could treat this like a red flag situation. And then the police departments are trained and know how to go further with that as far as dispatching someone to talk and make inquiries, etc. And again, if there's information that the person may be dangerous or unstable or homicidal, then that's information that needs to be contained so that the police can possibly prepare themselves with maybe a warrant before they come so that they can handle that situation as it unfolds with a warrant.
Great, thank you. And Krystal, in a situation like that, how is a loved one or a neighbor, how would you know if somebody do they really mean it or are they just venting? Like, how do you kind of filter through that?
Well, one way that you can help to decipher between if this is a threat to really harm themselves or if the person is maybe engaging in attention seeking is one, monitoring their mood. Monitoring their mood helps you to be able to decide if this is a real threat. Any threat that someone makes, you should take serious, but listening to how they say it or when they say it. If that person has recently lost a job, experiencing a mental health crisis, we want to take those threats pretty serious because they're experiencing a crisis and they need some support. If a youth is saying, I just want to end my life, you want to take that threat serious. One of the things that we use for the mobile crisis team is we use the Columbia scale, and that helps us to determine whether or not this threat is serious. So if an individual makes a threat, I just don't think I'm gonna make it through the day. Then we may ask them, okay, what is your plan? What do you mean by that? We'll dive a little deeper. Do you have means to a weapon? If that person says, I don't think I'm gonna make it that today, and I'm thinking of killing myself through the use of a gun, then we're gonna ask them, where's the gun? Is it possible to secure the gun? You wanna go ahead and dive deeper into that conversation with the person by asking them very probing questions to get them to be able to answer.
And so as trained crisis call takers, you certainly have been trained in administering certain scales and screeners. Would your advice to someone calling in be to perhaps just call the crisis line to get some additional assistance to take those threats and concerns seriously?
Yes. So if a loved one is concerned about their family member, call them into the crisis line. We can go ahead and call that individual and kind of take it from there. And asking the questions that need to be answered that you may feel uncomfortable with actually asking, or you may not be trained to. So calling into the crisis line, we're 24 hours a day, 7 days a week. Calling into that to get the support that you need to protect your loved one is the best route to go.
Great. And I just want to make sure that I'm crystal clear on this. So you aren't suggesting that family members should look up screeners and start
No.
to administer those.
No.
You're suggesting that they involve professionals rather than trying to filter through whether someone is serious or not.
Yes. I would suggest that you go ahead and get involved with a local crisis team or a crisis call agent to be able to support you in that. Not going and asking all the questions, but you, again, just as a loved one, you may just sit there and ask, is there a weapon around? So that if that individual is willing to give you that weapon.
Great, great. And that's important information for law enforcement and for first responders to have anyway, I would guess.
Yes, and certainly, again, if you're going to contact law enforcement through 911, the more information that you can provide about the situation, about weapons that are present, about the history of the person, that's all information that they need to know as they're responding, so that everybody can stay safe.
Great. Following up on that question, Prosecutor Mull, have you had cases in the past where maybe someone has said loved one and they thought, oh, they don't really mean it or whatever, and didn't take additional steps?
Yeah, unfortunately, I've had to review these cases where there were signs that the person was in distress, there was access to firearms, and unfortunately, human nature being what it is, the loved ones that were hearing this thought surely they wouldn't, and unfortunately they did. And so I think it's so important that when these things are being expressed, when they're being stated, when they're being, even suggested, that just to be safe, that you report that and let trained people intervene and assess whether that's, needs to be taken further with treatment and intervention or not. But it would be a terrible thing to live with that lifelong regret of saying, well, they said it, but I really didn't take it serious. So better to just exercise caution, have that intervention, and then everyone can move on.
Yeah. And again, 833-SAFE-988 for any time someone has a concern, and even if you're just not sure what to do and you're not completely clear on what your question is, there are trained crisis call takers who can help walk you through that.
If I could say one other thing, we covered this already, but I just want to emphasize that just the fact that someone calls 911 and expresses a concern and has the police come out and talk, or the intervention specialists come out, that is not anything that creates a criminal record for someone, that it involves necessarily involvement with the criminal justice system. Police officers all the time come out and talk and assess and leave, or assess and then call in for mental health interventionists to come in and assist. And that in no way gives anybody a criminal record or a criminal history or that they go to jail or anything like that. And, these calls come out often. And I just want to make sure that we emphasize that you're not getting somebody in trouble by doing that. People show up and are just wanting to assess and then to help and not to prosecute or arrest or put in jail.
I know we are very focused on mental health and access to firearms tonight, but since we have you here, I want to talk a little bit about intimate partner violence and domestic violence and the role that firearms play in just overall morbidity and mortality in those situations. Can you talk a little bit about that?
Well, unfortunately, firearms play a large role in many of these domestic violence incidents. A number of the murders, the homicides that I've prosecuted over the years have involved one person producing a firearm or a weapon and murdering the other. And that just seems to be a consistent, regular occurrence over the years. And it's not only murdering, it's a lot of times criminal intimidation with them. It's producing the firearms and threatening the other person. And oftentimes there are children in the home. And the children are traumatized by that. And the production and the use of these firearms in these domestic situations is common, and it's just a very dangerous situation, and it's very harmful to any children that are present, even if it's not discharged or used.
And once there is a firearm at play in those dynamics, does lethality increase?
Absolutely, 100%. When the offender kind of reaches that point of producing that firearm and producing it, then it greatly heightens the risk that there's going to be a shooting and a violent act occurring.
Okay. And so in a situation like that, again, someone could call 833 SAFE 98 and could receive some additional support in accessing services. They could also call 988 or 211 in both Indiana and Kentucky. But in those situations, what would you advise someone who may be living in a situation where there has been intimate partner violence or domestic violence, where there may or may not be a firearm involved?
Well, the first recommendation I would make is that you need to leave that situation immediately and get to a safe place. There are community agencies here that specialize in helping individuals in that situation break away from that, to find housing resources. But it's important for the abused individual to get away, and it's important for any children involved in that situation to be removed from that so that they remain safe. And again, you just have to get out of that situation and ask for help, because so often it escalates to where either the person or a child is harmed. And I prosecuted a case where it was a murder case where an individual murdered his wife and then tried to murder a child that was in the home by shooting at her. And that could have very easily resulted in the death of that child. And so I see these cases, they're real, they happen. And if you're the adult in that situation, for your own safety and for those of the children that you have to get out of there.
And I would imagine the mental health consequence for that child and for that family is really significant moving forward.
Oh, and just a lifetime, probably of trauma to deal with, and that trauma just affects people in so many ways, and in their professional life and their relationships and their own personal sense of self-worth and their own mental health. But it's like ripples in a pond that just goes across and affects every aspect of their being when they have been subject to that trauma or had to see it. It's a very harmful thing on a person.
Krystal, we're back, I think, in your area of expertise. Can you talk a little bit about it with the folks that you have worked with who may have experienced living in an environment where there was domestic violence? How does that play out across the lifespan?
So I'll start with the youth and kind of coordinate to what Mr. Jeremy was saying. when a youth, experiences any type of domestic violence or gun violence, the likelihood of them using a gun when they are suicidal increases because the gun is available to them. So a youth or the mother or father, whoever the one that is abused, you're increasing the likelihood of them using a gun on themselves or they're experiencing suicidal ideation because the gun is in the home as well. So one of the ways in which we can assist is by one, acknowledging when someone needs help. So if you have a youth, or a mother or a father who has experienced any type of domestic violence, we want to be able to provide them with therapeutic services because that is going to help them in the long run. If they're able to communicate and be able to receive the resources that they need to heal, that's going to decrease their depression, post-traumatic stress disorder, any anxiety that they may be experiencing by witnessing gun violence or domestic violence.
I want to pause here because I think we're getting near the end of our time together. If you have any questions, please drop those into the questions box on the Zoom and we will review those. Do we have any questions so far? Okay, great. We must be addressing everyone's concerns and questions, but to kind of continue this discussion and to talk a little bit more about a couple of areas. So I want to go back again because I want to make sure that folks leave this discussion with some tangible skills and resources. The first is 833-SAFE-988. For red flag enactment, you would contact local law enforcement and ask specifically about firearms.
Correct.
And I want to go back to just clarifying the steps on obtaining an emergency detention order. So if you are a family member that comes into a LifeSpring office during the week, what does that look like for you? If you are concerned enough about a family member that you believe they need to be in the hospital, and you know that you can go to LifeSpring for some assistance with that, what does that look like once someone comes in and works toward getting an emergency detention order that would require them to be hospitalized?
So most of the locations is also going to want to assess the individual if they can. If they cannot, then the family presents the case to them. They would then go ahead and try to get, they would fill out the emergency detention order and then secure a bed for them at, say, Wellstone or Clark to ensure that that person is able to be picked up and has a bed. The next step that they would do, or the individual would do, is reach out to the local judge in that county and be able to sign off on the emergency detention order. That individual would then be picked up hopefully within that day. Sometimes it takes a little bit longer depending on where the individual is, but we need to know that information as well. We cannot do an EDO or emergency detention order if we are not aware of where the individual is. In order to secure an emergency detention order, that person has to be either suicidal, homicidal, or gravely ill, or that individual is a danger like to themselves or to others. Just because an individual is maybe eccentric, does not classify them as being appropriate for emergency detention order. They must pose some type of harm to themselves or others in order to secure that. Once an emergency detention order is secured, then the individual will go to the hospital and be able to be assessed. No one likes to take an emergency detention order or complete one just because someone is just not being quote unquote normal. We need to make sure that that individual is a danger to themselves because again, we want to give them the support that they need, and the hospital is that higher level of care, but that person needs to be able to be there. It has to be one in which that person is not going to go ahead and go to the hospital themselves to make sure that they are
Okay, so just to clarify the process. So as a family member, I could come in and again, the criteria are danger to themselves, danger to others, or gravely ill. And gravely ill can mean a lot of things, but essentially they're not able to take care of themselves anymore in a meaningful way. And so as a family member, I could come into LifeSpring and say, here's the information, I'm interested in an emergency detention order.
Yes.
And then I would work with a therapist who would help me figure out if an emergency detention order was appropriate. And then LifeSpring could take it from there. They would work with the doctor, they would work with the placement facility, and really just helping get the paperwork together for that.
Yes. And then even after, one of the things I do like about, LifeSpring is the open access. So individuals can come in and get the support that they need. And oftentimes what we've seen is that some individuals will come into, open access and know that they may need hospitalization. And they're able to get the support there as well.
Okay, great. And so once someone gets to the hospital on an emergency detention, they're met by a physician who can help determine whether or not that's an appropriate placement and whether or not the person meets the criteria.
Yes, and once they're there and they've been assessed, they will stay there for approximately 72 hours, depending on the situation and the individual. Sometimes I think some individuals require longer, and sometimes individuals, they're able to get the help that they need, maybe it may be an increase in medication or starting medication, and they're able to do that at the hospital.
So there is no preset time necessarily that someone is in the hospital, they're just kind of continuously assessed for stability. Is that
Yes.
accurate?
Yes.
Okay, great. And again, you can access an emergency detention order process through 833-SAFE-988 or through any outpatient office at LifeSpring as the state designated community mental health center. Okay, great. Let me ask as we get close to the end here, let me know if there are any questions, Lauren. Is there anything that we haven't covered tonight that you think is important for our community to know?
Yes, I know we didn't get to cover this, me and Mr. Jeremy both kind of hinted around, but sometimes individuals, have a desire to die, through the use of gun violence from a police officer. If you know that your loved one has made threats that they plan to die by cop, that is often when we say suicide by cop, you want to be able to, one, let dispatch know that that individual has that plan, as well as if you can let dispatch know that this individual has weapons in the home. That is one of the areas that I don't think we got to touch on, but that has been increasing over the last few years.
Prosecutor Mull, can you touch a little bit on that? Because I would think that the impact on not just the individual and family, but also the law enforcement community is pretty profound.
Absolutely. It's a regular occurrence where officers encounter someone who wants to die and wants the police officer to shoot them. And as sad as that is for that individual, that suicidal mindset, it's also very, very traumatic for the officers to be put in that position, to have to make those decisions about what to do, and then heaven forbid they have to shoot that individual. Then there's a lot of feeling of guilt many times, and just a lot of things to work through for the officers that have to pull the trigger. Finding out that this person was mentally ill and really needed treatment more than anything, but put them in a position where they were required to do that, to preserve their own life or that of others. So certainly that's information that needs to be communicated so that everyone can show up and, hopefully have, less than lethal means available and readily available when they show up, and kind of understand what's going on so it doesn't catch them by surprise.
I want to close, Krystal, by first asking you to again reiterate how someone can access help. And then I want to turn to you, Prosecutor Mull, and ask you about just again to reiterate what are some things that each of us can do today to make our community safer from firearm violence.
With the mobile crisis team, The first way to contact us is through our crisis line, and that is 833-723-3988. From there, you'll be able to be provided with a crisis call agent. Someone is always available to be there with you, to walk alongside with you 24 hours a day, 7 days a week. So our mobile crisis team is able to meet you where you are, to support you, even if you're at the local Dairy Queen down the street or at the library. We will come and walk alongside with you and get you to the resources that you need. It may be that you need a place to stay for the night. We will assist with that. We collaborate with different organizations to ensure that we're able to be a resource to everyone.
Okay, so 833-SAFE-988.
Yes.
You can also call or text 988, call or text 911.
Yes, if you go ahead and contact 988, they will connect you with your local crisis team, which in this area is LifeSpring Mobile Crisis Team. We're available 24 hours a day. If you text 988, they will also be there. They are also 24 hours a day as well. In this area alone, we cover 11 different counties throughout southern Indiana.
Great. And I would just encourage everyone to go ahead and store that number in your cell phone, keep it close. You never know when you're going to need it. Again, 833-SAFE-988. Prosecutor Mull, final word tonight. Can you talk just a little bit about ways that we can work to keep our community safe?
First thing I would say is that it's so important to parent children in the community to communicate with them, to ask them what they're doing, who they're with, to the best that you can know where they're at, to ask them about firearms, about their attitudes on firearms, whether they have firearms. You know, also to ask your children if they feel threatened. So many of the kids are carrying guns because they feel threatened by someone. And to just communicate to the children that if you're feeling this way, we can intervene, we can get involved, we can get the police, the prosecutor involved. I'm eager to file actions against individuals who are threatening children, other children, however we need to do that through the juvenile system, but we can get involved and stop a lot of this. But you have to ask your children, you know, what would cause you to think you needed to carry a firearm? Anger, bullying, fear, and have those discussions, and then, you know, make the appropriate interventionist type decisions. And the second thing I would say is to the adults is secure your firearms. So much of the violence that we're seeing is being perpetrated with stolen firearms, and a lot of times, again, it's juveniles. They're stealing these through getting them out of cars. They're stealing them by going into the homes of their friends and getting them from their parents, and when they're unsecured in the homes. But the vehicle security issue is a big one. And in fact, just today I reviewed a case where there was a juvenile stopped for a crime and had, in fact, a stolen firearm on him. And this is just something I see very regularly. So lock up those firearms, don't keep them in the vehicles, and that can cut down on some of these incidents too.
Thank you. Thank you again for joining us tonight. No questions, Lauren? Okay, I think that means we've answered all of your questions. Again, I would just encourage you, if you are concerned about yourself or someone in your life, please reach out for help. There is an abundance of resources locally, and we can make sure that we're all working together to keep our community safe. I'd like to also thank the New Albany-Floyd County Library for hosting us tonight, as well as the consortium of local service providers who have worked to bring you this series on addressing firearms in our community. We as individuals can accumulate trauma, and so can our community. But if we continue to work together, we can really start to make a difference in making sure that we have less firearm violence and a safer community. Thank you.